Good morning, and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
We're doing quite well.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute's Facebook page. Today,
Cool.
Dr. Murphy will be addressing the latest headlines and our lone US COVID statistic through today, January 17th. We invite you to submit questions down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with our abbreviated COVID statistic, average COVID deaths per day in the last reported week were 59 daily. And in comparison to the same week in 2023, right at the end of the year, we saw 318 daily COVID deaths. Your reactions to those numbers, Dr. Murphy?
Well, the number of deaths per day, which is the only hard metric that we have now, is basically unchanged for the last few weeks or even months. I think the important thing to note is that compared to last year, it's markedly less. We had over 300 and some people dying per day, and now we're down in the 50s. So this is really due to the herd immunity from all the vaccines and all the COVID cases that we've had.
Mhm. And
Good news.
looking at one of those softer metrics, the wastewater, I understand there have been some changes, so we may see an uptick in cases, but hopefully not like what we saw last year.
Yeah, it's high or very high in most places, but even now they're reporting in the West Coast that it's dropped down to moderate. So this is not unusual, but it really is everywhere in the country right now.
Mhm. And we have a few related COVID reports. One important one came about hMPV, which is the only pre-exposure prophylaxis for COVID-19. Can you tell us about that update?
Yeah, Pemgarda is a monoclonal antibody that is used to prevent COVID. So it's pre-exposure. It's not used for treatment. It doesn't work for treatment. And so we've had several of these monoclonal antibodies before, but the virus mutated and then they didn't work anymore. So this is a new one. It's geared towards the circulating viruses now. And if for some reason your body cannot make an immunologic response to COVID, and here we are in COVID season, this is a treatment that you can take to prevent getting it.
Mhm. And speaking of people who really should be looking for that COVID-19 vaccine, there was another report linking maternal COVID infection, so a pregnant woman getting COVID, and some respiratory distress in their newborns. Can you tell us about that?
Yeah, well, as time goes on, more and more data get collected. And so what you're referring to is a systemic review of the literature published in BMC Infectious Diseases, highly respectable journal, that looked at 22 relevant studies. And they found that respiratory distress syndrome in children to mothers was much higher in women who had COVID than if they didn't have COVID. So you don't want to get COVID, basically, or your kid has over 2.5 times greater chance of having respiratory distress syndrome. So this is the kind of information that we get, after, study after study after study and putting it all together. And it just proves, that it is distressing to the fetus and the neonate if the mother had COVID while she was pregnant. So, pregnant women really need to keep up with their vaccinations is really the name of the game.
Mhm. Now, one of the largest global stories in terms of infectious diseases for the past few weeks has been hMPV, a virus that seems to have been upticking in China, and there was a lot of hysteria here in the US about what this could mean. Can you tell us about hMPV and about the actual numbers that we're seeing?
hMPV stands for human metapneumovirus. It is not a novel virus. It's really not new. It's one of the many causes of the common cold. Matter of fact, right now in several states, it's testing, people are testing positive about 6% of the time, people coming in for a test because they've got a respiratory symptom. So people in Iowa, Kansas, Missouri, Nebraska, they have the highest rates right now. So this is nothing new. However, kind of the weird thing, and why I think the misinformation spun out a little bit, is that, of course, coronavirus or COVID, that family of viruses, is another cause of the common cold. And of course, it mutated, and look what happened. We had a pandemic. So, you just put all that story together, and there's all these crazy things going on there. But what they're talking about here is another disease. It's also related to RSV. It's in the same family as RSV, so respiratory syncytial virus. So, that's, it's a common cold, and it usually doesn't cause much trouble. And there's no big panic to worry about, but you're going to be hearing more about it because we're going to be looking at these common cold viruses a lot more closely as time goes on.
Now that or at least the public is more generally aware of all of the different things that could lead to something like this, of course, it's going to sound alarm bells, but nothing new here.
Well, I mean, we used to never test anybody if they had a respiratory infection unless they were really sick, and then they got tested. But now the testing, we can test for everything pretty quickly, especially if you show up in a good emergency room.
Now, our other huge story that we have been following for months and months now is the H5N1 avian flu and also some other global avian flus. There's been a lot of news about this the past week, so can you fill us in on everything that's happened?
Well, we've been reporting over the last couple of weeks about the unfortunate elderly person in Louisiana who passed away, had underlying medical problems, and was over 65 years of age, which is the classic person who has, severe problems from any kind of flu. That person passed away. So, but they're now reporting more avian flu. We had 66 cases as of just the other day, and now there's another case in a child in San Francisco. And the other news is, remember, we had talked about a very, very critically ill teenager in British Columbia. That turned out to be a 13-year-old girl, and she has completely recovered. So that's all good news. What's happening, though, is that we're getting reports of sporadic cases, of course, where they're also seeing reports particularly in cats. Cats that have been consuming raw milk. Several of those cats have died from avian flu. And we just heard actually yesterday that a flamingo and a seal at the Lincoln Park Zoo actually have passed away from avian flu. So the flamingo should be no surprise. Flamingos are birds, and it's highly contagious among birds, and they have some interaction with wild birds. But the seal is that's a new one, but it goes to show you that it's not just poultry and wild birds and cattle, but many other species can get avian flu. And we're really lacking in general knowledge about this. We don't know how much is in the other animals on the planet, as well as in the humans. We don't know really. We don't have the background information yet, and this is critically important. The birds have been devastated by avian flu. They're recovering. But we don't know about other animals.
And I understand there's been some very little information, but some reports coming out of China as well, with a couple of cases of different avian flu strains. Do you know which ones those are?
Yeah, no, there's several different strains of avian flu, and they're reporting in younger people, 1-year-olds, 8-year-olds, 23-year-olds from different provinces in China. They're reporting that they've gotten it. They're not saying how they got it. The reports are pretty vague right now. I presume that it's being looked into, but still, there's no evidence for human-to-human transmission yet. But at least people are looking.
Yes, very good to be looking. And speaking of looking, our final story today revolves around the RSV vaccine and Guillain-Barre syndrome. Lots of people have been looking into this. Can you tell us what they found?
Yeah, so Guillain-Barre is a form of ascending paralysis. It occurs just in the population, but it had been first noted increased after swine flu, but way back many decades ago. And it has been reported after several vaccines have been given periodically. It occurs pretty rarely. And so what the FDA noted, they have a voluntary system called VAERS, and that stands for Vaccine Adverse Event Reporting System. And so you don't have to do this. A person can submit this, a doctor can submit, anybody can submit one of these reports. So, you don't have to submit it, but you can submit it. And so there can be selection bias here. But anyhow, they think that there is a risk with these RSV vaccines, which are given primarily to people over 60, 65 years old in the first 42 days after vaccination. And to put it into some kind of perspective, that's an increased number of a very rare occurrence. So they're talking about maybe 7 or 9 excess cases. Now, these cases do not necessarily cause death or permanent paralysis. Mostly they get better, but all of them are being reported here. And this is happening we're talking about 7 to 9 excess cases of Guillain-Barre syndrome, which occurs naturally, per million doses of vaccine. So that's a very, very small percentage of people. For instance, your chance of getting struck by lightning, and lightning's not always fatal, by the way, is less than 1 per million. So that's, there's risks kind of for everything. A serious head injury from a bicycle accident is actually 420 per million people. So it's somewhere between that, more on the lower side, but that's the kind of risk that we're actually talking about. So it's a very small risk. It's just a warning that especially if you've had really almost any kind of vaccine and you start feeling weakness in your legs, and that weakness is, especially if it's spreading upward in your body, you need to get evaluated quickly for Guillain-Barre and get treated.
Mhm. So something important to note, but it seems like the benefit of that vaccine likely far outweighs the risk of some of these side effects.
Exactly.
Well, on that note, thank you so much, Dr. Murphy, for breaking down the latest news, headlines, and data for us. It is much appreciated.
Well, thank you.
And thank you all for joining for our second 2025, installment of the Ask Dr. Murphy series. We hope to see you back next week. And as always, if you have questions or suggested topics, please leave them down below in the comments or at any of our social media linked in the description. We'll see you next week.